One of the first studies providing data on how brain health is impacted by COVID-19 was published yesterday.
Fox 13's Aaron Cox spoke with those researchers at Oxford University and COVID-19 patients here in Utah who say they're experiencing exactly what this study is talking about.
Researchers looked into health records for those 10 years and older. They also looked at anyone who had a respiratory infection or was officially diagnosed with COVID-19. Research from records, some say, show their everyday reality. Jess Monson says she's never dealt with depression before.
I feel like I cannot do the things that I've done with them.
But after having COVID-19, she's been on 10 different medications and is seeing therapy because her physical symptoms are impacting her mental health.
The days decide for me, like how it's going to go sometimes.
Something others say they're experiencing.
The mental health part of it sometimes ends up being the worst.
The good news is they're not alone. Professor Paul Harrison and his colleagues at Oxford University looked into the brain health of those who had COVID-19.
How did you guys differentiate between, okay, this is circumstantial depression due to COVID-19 or it's neurological?
The honest answer is you can't really distinguish those clearly. So first of all, I say because we compared the rates of depression after COVID with rates of depression after other health events occurring at the same time.
Harrison says 20 to 50% of the more than 200,000 COVID-19 patient records showed they had depression or anxiety. That's 1/3 of the population group they studied. The majority of that 30%, Harrison says, were between the ages of 40 and 45.
After COVID, you're at risk of both what you might call physical health problems and mental health care problems. So I'm hoping that again in the US and in Utah, you're again getting those messages across as well.
A research study that hopefully can help those still recovering months later after getting the virus.
Kind of have to be the pioneers in this whole thing.
Professor Harrison believes that having anxiety or any mental health disorder after COVID-19 does not make it any less treatable. He says to talk to your psychiatrist like you would your healthcare provider. In Salt Lake City, Aaron Cox, Fox 13 News, Utah.